Tara. I'm going to be your student nurse today. I'm going to close the curtain for privacy and wash my hands. And can I see your wristband, please? Will you please state your name and birthday?
Salila, 11/14/96.
Okay, and can you tell me what year it is?
2016.
And can you tell me where we are?
School.
Okay, the patient is alert and oriented ×3. Are you feeling any pain today?
No.
And do you have any allergies I should be aware of?
No.
Okay. The patient's mood is appropriate for the situation. Her speech is clear and there aren't any slurs. And her hygiene is well kept. There is no obvious body odors. And can you bend your head so I can now check your head for the first of the assessment? There are not any obvious lesions or bumps, and the hair and color is distributed evenly, and there are no critters. And you can set up your head now. Okay, and now I'm going to check your eyes for equal consensual light reflex. So just look at my face. Both eyes constricted equally. Her pupils are round and her eyes are symmetrical. And I'm going to check for accommodation. Just look at the pen light. And both of her eyes accommodated equally. And now I'm going to check your mouth. You could open. Her inner and buccal mucosa is pink and moist. Her teeth are all intact. Her tongue is midline and also moist. And her uvula is midline as well. And can you say ah?
Ah.
Her uvula raised when she said ah, and I would grade her tonsils at about a 1+. And now, can you please puff out your cheeks for me? And smile. And bite down. And now, can you close your eyes? I'm going to touch your face. Just tell me where I'm touching.
Forehead, nose, cheek, chin.
Okay, and cranial nerves 5 and 7 are both intact. And I'm now going to feel your neck for your carotid arteries, and one at a time. Her carotid arteries pulse is equal bilaterally 2+, and I'm going to listen for bruits with my bell and my stethoscope. Hold your breath when I place this on your neck, please. Hold your breath again. There are no bruits present, and I'm going to listen to her heart with the diaphragm of my stethoscope. I'm going to start with the aortic, and it is the right intercostal, the right sternal border in the second intercostal space. And the pulmonic, which is the left sternal border and second intercostal space. Herbs, which is the left sternal border, third intercostal space. And tricuspid, which is the fourth intercostal space and left sternal border. And the mitral, which is mid-clavicular line and fifth intercostal space. I'm going to listen here for 60 seconds for the apical pulse. Now I'm going to turn around. I did not hear any murmurs or anything at the mitral. I'm going to turn around and listen with my bell back up. Mitral, tricuspid, herbs, pulmonic, and aortic. I did not hear any murmurs or anything, and now I'm going to listen to her lungs with the diaphragm in 10 places. Please take a deep breath every time I set it down. 1, 2, 3, 4, 5, 6, 7, 8, and on her side, 9, and 10. And now if you could turn around so I can do the back. Same thing. 1, 2, 3, 4, 5, mentioned adventitious lung sounds. They were clear. And now I'm going to check your upper extremities. There is not any obvious lesions or scarring, and I'm going to feel for temperature. They're both warm. Her skin color is normal for ethnicity, and now I'm going to feel for your brachial pulse. And radial. They're both 2+ bilaterally, the brachial and the radial. And I'm going to check for capillary refill on both hands. And they're all less than 3 seconds. And now can you make a heart? And there is no clubbing of the nails. And can you squeeze both my hands? And the strength is equal in both hands. And now I'm just going to check your diaphragm for vowel sounds. I'm going to inspect first. There is no scarring. Her color is normal for her ethnicity. And her contour is flat. And now I'm going to listen for vowel sounds in all 4 quadrants with the diaphragm. Starting with the right lower. The right lower has the appendix, the right ureter, and the right ovary. And I'm going to listen to the right upper. The right upper has the kidney and the liver and the gallbladder. Now I'm going to listen to the left upper. The left upper has the kidney, the stomach, and the body of the pancreas. Now I'm going to listen to the left lower, which has the sigmoid colon, the left ureter, and the left ovary. Vowel sounds were present in all 4 quadrants. And now I'm going to palpate all 4 quadrants as well. Tell me if you feel any pain. Right lower, right upper, left upper, left lower. Did you feel any pain?
No.
Now I'm going to percuss, same way. Any pain?
No.
Okay, and you can sit up. And while she sat up, I checked for a jugular vein distension, which was not there. And her anterior posterior angle is a 2-to-1. And now if you could scoot back, I'm going to check your lower extremities. Okay. And her legs are warm, and there is no edema, and her skin color is normal for ethnicity, and there's no obvious lesions or anything. And I'm going to check her popliteal pulse. I would rate it about a 1+ bilaterally. And now I'm going to check your dorsal pedians. I would rate them both a 1+ bilaterally, and then your tibial, which is a 2+ bilaterally. Now I'm going to do the Babinski test on both your feet. She has a negative Babinski test. And if you could stand up for me, please.
Can't fix me faster.
Yeah. And she stood up easily. Do you feel any dizziness?
No.
Okay. And now if you could please bend over. Checking her spine for alignment, for any scoliosis or anything, but it seems to be straight. Now you're just going to feel a small tap on your back. Just tell me if it hurts, okay? Okay. That was checking her costovertebrate angle. And now I'm just going to have you stand there and close your eyes for 20 seconds. There is no swing or anything. That was the Romberg's test. There's no swing. And can you please walk to the desk? And her gait seems to be steady. And